Well, the White House monkeypox response team and public health officials are holding a briefing today to address the latest on vaccinations in an effort to curb the outbreak. The White House is saying that a total of 1.1 million vaccine vials will be available for those most at risk now. Let's talk about this some more with ABC News senior national policy reporter Anne Flaherty, as well as ABC News medical contributor and physician at Stanford Children's Health, Dr. Alok Patel. So, Anne, what have you taken away from the briefing thus far?
So, Kira, the latest that we just heard from the CDC director, Dr. Rochelle Walensky, is that numbers are going up. The infection rates with monkeypox are on the rise. But she says she has cautious optimism because she's seeing mitigation measures in cities like San Francisco, Chicago, and New York. She says those education efforts and vaccinations there seem to be working. The other thing we got from the CDC today was that they're reporting for the first time some sample numbers of vaccinations across 19 jurisdictions. We know that 207 shots have been given. They're going to be updating this. They say the vast majority of shots have been received by men. This is not surprising because those are the people who are mostly eligible because they're at the highest risk, men who have sex with other men. The other thing that we learned today was that about half of men report changing their sexual behavior because of monkeypox. And the CDC says they believe that if they do this, this could reduce the risk of infections across the country.
So, Alok, health departments across the country say that they're able to get several more doses per vial by dose stretching. But is there any evidence that that's effective?
You know, at this moment, Kara, we don't have a clear-cut study telling us that that method is effective. What we have is a previous clinical trial showing that an intradermal injection, so basically the new method of doing this, will still elicit a good immune response. We need to see what this is going to play out with in real time. But I think one of the bigger questions is if this is actually something that's being employed, because it is a different technique. It requires different training, and not every person out there administering vaccines is comfortable doing this. And another part of the briefing that I was happy to hear about, but I wish we had addressed this earlier, is the inequity in vaccine delivery right now, Kira. The CDC reported that about 10% of vaccines have gone to Black individuals when they represent 30% of total cases. So right there is a mismatch in numbers that kind of echoes what we saw earlier in the COVID-19 vaccine rollout.
So, Anne, you mentioned the CDC says it has begun counting monkeypox vaccinations for the first time since the outbreak began. More than 200,000 shots have already been administered. So why did they start doing this now and not earlier within this outbreak?
Well, you know, Kara, this has been amazing to me. I covered the COVID outbreak 2 years ago, and I remember Vice President Mike Pence at the time sending out letters to hospitals and jurisdictions saying, please, pretty please, let us know how many, how many cases you have of COVID. There was no way to do it. They had to email it to the White House. The CDC has come a long way since then. They do have a better system, and it does take time for these jurisdictions to report data. You know, I will say that it's also voluntary. They have to agree to give this information to the federal government. And so it does take time to gather. But at the same time, you know, this outbreak began in May. There's obviously very good questions about why this wasn't done sooner and why we didn't have this earlier.
So, Dr. Patel, cases are down globally and are down in the original epicenters like New York, Chicago, and San Francisco. But cases across the U.S. continue to rise. So what does that tell you?
Well, what I make of this is behavioral change, exactly what Anne was mentioning earlier, what the CDC has put reports out on. And this potentially reflects a change in human behavior, such as limiting the amount of sexual partners you have, being a little bit more aware of people around you who may have symptoms or may have been exposed, and actually going out there and getting the vaccine. And this likely is what is contributing to a decline in cases. And while we still have a rising cases, the trajectory is slowing down. And so hopefully that continues to take place as we try to kind of curb the spread right now of monkeypox. And, you know, in general, what we're seeing, all of us, all healthcare practitioners, is a lot of people who have those early symptoms and are worried about if this is monkeypox, who have they spread it to, and what actually could potentially happen if they do contract it. There's a lot of people out there who could have something like these fatigue, fever, body aches, and then develop a rash and not really know whether or not it is monkeypox, which is why we also still need to make sure that testing and access to healthcare is available.
Anne and Dr. Patel, thank you so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.